All right. So let's go ahead and get started. First of all, thank you all so much for coming to sort of join this discussion on this topic. It is a little bit different than a lot of the virtual sessions that GlobalPDX has been leading recently because I can really see a trajectory for this conversation to become more of a working group and more of a community that can really share resources around how we're communicating COVID to both our foreign counterparts and partners, and also sometimes people who work here at home, and we just kind of need to normalize the discussion and to really get comfortable speaking about how to stay safe. So I'd first like to hand it over to Sheila, who really was the impetus for getting this group together and for this virtual session. And Sheila, please go ahead and tell us a little bit about your work and how you were inspired to call this meeting.
Okay, so just tagging on to what you said, I think that, well, communication is key. And I see through my years of various international experience, and local experience too, that communication is often is a huge piece that's missing. And people tend to just do what they do and feel that they do it best or whatever, but don't reach out to learn from others. And I think in this case, everything is new for everyone. So it's a little bit easier maybe for people to share their concerns or their hopes, whatever. So that was my reason for calling Jennifer and asking, hey, can we pull something like this together? So what I'm doing now after Malawi, which Kay, you didn't hear about, but so after Malawi, I returned to America and I'm assisting my husband, who is taking care of his late 90s parents in Honolulu. And so I'm here, and I'm from Portland, but I'm looking at, I'm volunteering at whatever I can do here. I had a paid job as the COVID response manager for the organization here that supports COFA migrants. And COFA, I don't know if you know who they are, it's the Compact of Free Association nations in the Pacific, the West Pacific, who were bombed and still are being bombed. And the military, U.S. military has given, and the U.S. government, the Department of Interior has given a right to work and be in the United States without a visa, without papers, because in exchange for the right to use the land, air, and seas in perpetuity. So this group of people are here, but and they're in Oregon as well, but they don't have access to the same services because they are prevented from Medicare and Medicaid and all of these services. So anyway, they're a very interesting population, very nice. They're people, the culture is very collectivist rather than individualist. So there's a clash of cultures. They don't understand the US approach to things. So I've been working with them. The funding fell through. Now I'm a volunteer, but I'm still doing the same work. The things that I'm focusing on are messaging, because in around the world, and I can speak for Malawi as well, messaging that gets out to the people is often not culturally responsive, and it's not in languages that people understand. Here, it's the exact same thing. People don't know what's going on. So messaging is key, and I'm helping organize that. And distributing food, distribution of other essentials is key because of all the confusion around what COVID is and what you're supposed to do or not do. People are afraid to go to the store because they will be arrested, actually. And there's a huge fine here. And so they're starving. I mean, they don't have food, access to food. So I'm trying to help with getting food and other necessities. But I feel this is Hawaii, but I feel that this is not so different from my friends who are working in Malawi, South Sudan, my friends in Cambodia, but I haven't gotten a response from them, Kenya, various countries. So I sent out 7 questions to these friends asking, and I will put those up in just a minute, And then I got some responses. Primarily, the two that I highlighted are Kenya and Mexico. My friend in Mexico is a healthcare worker in Portland, and she's from a small village. Doesn't speak the best English, but her she's in constant conversation with her village in Mexico, and her comments are very interesting and relevant. And then I have a set of questions to ask that I think we should all be discussing, not just our group here. I think the aid community at large should be transparent and discussing. So that's where I'm at. We have a new member, I see. So
yeah, welcome.
Jennifer, you want to introduce her, and then I will put my questions on the.
Sure, I think let's take a step back for a second and just sort of figure out where all of our intersections of interest are. Because I think we all work, obviously, to try to create some positive change in the world, and it's a tricky but really important time to keep doing that. And I think probably all of us have really different reasons why this topic is interesting. Either we have coworkers or partners or allies who are working abroad and they're receiving different messaging than we are, and there's a need to sort of create a story that can be shared really clearly and really sensitively with our partners. Or maybe more so we're looking into starting that conversation and want to hear some of the successes that the others in this group have had, and also some of the challenges. So if you guys don't mind, I'd love for us to go around, just introduce yourself, the organization you work for, or your area of interest, and then why this particular virtual session spoke to you. So Molly, I'd love to start with you.
Sure. So my name is Molly Hiller. I recently moved to Portland last Tuesday, actually. I am a current consultant with the World Bank on their Cambodian nutrition project, focused mainly on maternal and child health nutrition. And I'm the project coordinator for that project. So I was a Peace Corps volunteer in Cambodia for 2 years, and then came back to the States and finished a degree, and then joined World Bank and came back in March of this year because of COVID and everyone going back to home countries. And so a lot of the work that we've been doing is supporting the ministries that are implementing the project on, now all of our sessions are virtual, and how we're dealing with virtual capacity building and on the ground training for these subnational actors that will implement the project. So that's a lot where how COVID's kind of impacted our project. And I joined this session today to see, mostly just start getting involved in the international development community in Portland and meet more international development folks. So that's me.
We're so happy to have you, Molly, and again, welcome to town. Sarah, let's go to you.
I'm Sarah Howard. I'm the development director at These Numbers Have Faces. We work in Rwanda with university students, and I was interested in this conversation just because we're communicating cross-culturally in Rwanda and in the States of what's happening with COVID and how that's affecting our programs and our donors. And so just being really relevant conversations to be having. And so I'm excited to be here today. Thank you.
Excellent. Good to have you, Sarah. Kay, let's go to you.
Good morning. I still have my morning workout stuff on. The joys of Zoom meetings these days. I'm Kay Matson, and I work as an independent consultant. I've been doing that since about 2011, mainly on public health and WASH programming. And with respect to COVID, obviously I've, work in that sector is all become remote for the most part. And also as a consultant dropped off considerably because there's just fewer of those things. But I am working with UNICEF on communications for workplaces with respect to COVID. So there's been some materials developed with Rosa, and now working with the Southeast Asian office to prepare workplaces specific to WASH or things that they can do to prepare their workplaces for workers returning back to work and being safe in doing so. So some of that's been targeted to agriculture settings, and others been to ready-made garment factories. And so I've been working with them, and then also the World Business Council on Sustainable Development with their WASH pledge, and kind of making that more applicable to more rapid assessments with respect to COVID. And so I'm just here interested to see what other folks are doing, and sharing those resources. We'd be happy to do that as well.
Excellent. Thanks, Kay. And finally, over to Mario. Mario.
Hey, I'm here.
Hi.
Hi. So I am, I was a Peace Corps volunteer about 10 years ago in Nicaragua. I was a community health volunteer. And then when I came back to the US, I worked in public health for about 5 more years at a reproductive health clinic, and well as sexual assault services, support services. And then I made a bit of a change in my career. I decided to become a graphic designer. I've done design for nonprofits, international aid organizations. I wanted to continue to support public health, but from a different angle. And just recently, I accepted a job at Public Health Institute as a contact notifier, more commonly known as a contact tracer for COVID. And I'm working to support the Clark County Public Health Department. So I started with Public Health Institute about exactly a week ago. So I just learned about GlobalPDX about a month ago. I believe I'm friends with one of the board members. I believe he's one of the board members. And so I'm just, casually following the emails that I received, and I saw this, so I was like, could be interesting. It's relevant to my work right now. And I'm also training to be a medical interpreter, Spanish to English. So I think all this has to do with health communication. And so I'm just really interested to be part of the conversation. I'm on my lunch break, so I might have to drop off early, but I just kind of want to be more of a observer, if that's okay.
Yeah, absolutely. First of all, welcome. Glad you heard about us. And certainly, if you guys would prefer to sort of take a seat and listen instead of pitching into the conversation, you're very welcome to participate how you'd like. At this point, I would like to turn it back over to Sheila, who's sort of prepared a list of questions that she thinks could be a good guide for this conversation moving forward. But also feel free to jump in if you think that we can expand on these questions, or if there's a way that we can make this conversation fit better for you and fit better for the group, and really lead us towards something solid and something that we can begin to share. So Sheila, I'll turn it over to you.
Okay, let's see. Whoops. Okay, let me get this up. I should have had this up, sorry. So these are the questions that I was thinking that we need to be talking about, and I'll explain them more. But first, I wanted to share with you the 8 questions that I sent to my friends in Africa, Asia, and Mexico, which is where my friends and colleagues are working, and just share it with you, and then tell you a couple of the responses, which might trigger some thoughts. So I was very interested in, in government, both national and local governments, how they are working. In Malawi, the national government is taking the lead, but anyway, I wanted to know how they are coordinating their responses so that in order to reach the most marginalized people. And then how NGOs and church organizations also, because in Malawi, again, it's the church organizations who have the most clout, and they are actually able to reach the people. NGOs work sort of superficially, and government is somewhat feared, but not really respected. And number 3 was, I was asking them, what do they think the strengths and weaknesses of the response effort to date are? And related to that, I wondered, are the communities overwhelmed? How are they dealing with this? And do they feel their voices and their needs are being recognized by the decision makers, which is a huge thing that I found during my work in Malawi, is that the village voices and their true needs were often not as important to the implementers as their own as the donor directed efforts. So I wondered, I asked, are local communities included in the discussion? And what stands out, good or bad? And what lessons, both positive and negative, can we learn? To these, I just wanted to say, my friend from Mexico is a villager herself. You can, those of you who speak Spanish can really appreciate her attempt at English, because I asked if could she write it in English, and she did, and I thought it was great. But basically she says the government doesn't help at all, period. And that if anybody, even if they have a doctor, they can't afford it. And if you complain, nobody will listen. So that was the Mexican response. The Kenya response from a friend who runs a clinic near Nairobi. This, I think we could say in many countries. The rumors are that Africans can't get the virus because they're strong and immune. And anyway, you can drink enough alcohol and it will kill it. But importantly, if you have it or have symptoms, don't tell anybody, because you will be isolated. And that's, as all of you know, if you're isolated, that's the end of, you can't get anything. That's your whole life. And there's a huge stigma attached to being tested at all, just like in the early days of HIV/AIDS, and still today, actually. People don't want to be tested. So back to the questions I think we should talk about. We have, what are the immediate needs? And I'd like to hear everybody's input. This is, I must say that this is, selfishly, I want to hear what you say, because I'm working with the Micronesians here, and the situation is dire. 4% of the population has more than 30% of the cases and deaths. It's really hard. But what are the needs of communities as seen by the community members themselves? Because they know, and often the outsiders are deciding what they need. But hugely, the messaging about facts, how to take care of yourself and what the virus is, needs to be culturally responsive in the languages that they understand. Micronesia itself has 27 languages, but 5 language groups. So even if all this was translated into 5 languages, the people could understand, including the voices of the communities, engaging community leaders, because in many marginalized communities around the globe, there's great distrust of NGOs, there's distrust of their own government, but the community leaders, they trust. So that's who needs to deliver the messages and the resources. So we need to discuss that, and we need to think about the people who have lost their jobs or are quarantined, they can't buy food, etc. But a huge issue in the developing world, including here, but not so much here in Hawaii, are the other health issues. The ARV, the HIV medications and malaria medications and many others are taking a back seat and are not being distributed to those who need them. And then, of course, we have children who are at risk for many things, as children are safe in school. So they've lost their safe spaces. What's going on with the kids? So let me get out of this. I think those are the questions that are on my mind, and I would love to just hear what everybody has to say about either those questions or anything that crosses your mind about how we can help people who are fearful and impacted by this, and whether NGOs and government agencies and the UN agencies, whether they are communicating and reaching the people with their needs. So turning it over to you.
Yeah, my first instinct as we're having this discussion is that I also really want to bring to the fore the idea that while we can discuss and share resources and try to amplify our impact, it's also really important to be talking with those community partners that we have who live abroad or who live in different types of communities and learning their lessons. I feel like I learned so much living in Mongolia about how to minimize my social interaction, how to really not waste things such that you didn't have to go to the grocery store every day. And I had never been in quarantine before. I think it's a first experience for a lot of Americans, but speaking for my own personal village in Mongolia, quarantine happened about every third year when there was some sort of an outbreak. So I just want to make sure that we all have that at the front of our minds too, that it's not that we are sort of the knowledge bearers or that we have the final solution, but that we want a place where we can bring in those solutions and share ours and really have a respect for all of the different expertise that is around the world. And of course, to also throw in that there are many parts of America that might also need some additional communication as far as how to stay safe, and that certainly we're not doing it perfectly. So that was just sort of my first reaction. Yeah, who else wants to jump in?
I'll just say that was actually, I don't know if I expressed it well enough, but that's my key point. I think that's the most important point, is listen to the people and respect their knowledge. Indigenous knowledge is like great. So thank you very much for saying that so well.
Perhaps, Sheila, we can have you go down the list of questions and sort of pose them one by one that we can respond to.
So do you want me to put it up or I'll just ask?
Asking is okay.
Yeah. So the questions that we need to be talking about are, what are the immediate needs? And this is something for people on the ground as well, but what are the immediate needs of the communities as seen by the community members? Either that, or would you like the questions that I sent to my friends on the ground? Which do you think we should talk about, Jennifer?
I think that your first question, the what are the needs that we are seeing?
Yeah, okay.
Communities is a great one to open it up with.
Yeah, the needs that we see, and that if we are communicating with people who are on the ground, what they see, and hopefully with villagers, what they see. That would be great. Mm-hmm.
Anyone have anything they want to jump in to share? Maybe not quite yet. Do you want to go to the next question?
Let me just throw in a need that I see, just to maybe get it started. Mm-hmm. The need that I see here, I mentioned, is clear messaging. Messaging that actually is culturally relevant as well as in languages. I can say that that's important here in Hawaii for the Micronesians, and it's huge. But I can also say that it's true for my friend Maria in Mexico. Her village needs messages not coming, yes, maybe from the government or from NGOs, but whoever it is, with local leaders and local languages, and recognizing the fact that people are very poor and they cannot quarantine. They have to go work. They have to feed their families. So I think messaging that is that understands the culture where the people are is key. Because people don't want to flaunt it. They just have their needs and they don't really understand. So that's what I'll throw out.
Yeah, Sheila, that makes me think of the need for sort of a compiling of really compelling and interesting and clear graphics. And perhaps those of you who are working more around COVID communications know of a good source for that. But I personally have seen a lot just pop up on social media that I think, wow, that's a well done image. That's pretty clear. But again, a lot of those graphics are depicting people, frankly, who are white, because frankly, they're made by often white people, or are trying to speak more to the American public, which for some reason is depicted as white people. So there's a need there as well to bridge that gap, which I think speaks to what you found, Sheila, which is that there were some people in Africa that you contacted who felt like, or perhaps the idea was, this is more a problem for people elsewhere. This isn't as significant for us. And I can only imagine that our imagery and our communications are hurting in that sense, and are not clear.
Yeah.
I think that these questions are hard to answer for us, because I think there are questions that we can ask people who are experiencing these challenges, if these are challenges for them. I think that we're all coming from with good intentions of trying to understand someone else's point of view, but ultimately we cannot, because we can't be in their shoes. All I can say is, from what I have gathered from, for example, my friends in Nicaragua from my Peace Corps experience, is I think that they perceive coronavirus differently than we do in the US, because of the political approach. The leadership around coronavirus has been very different than it was in the US. At the beginning, Ortega, he denied that coronavirus would affect Nicaragua. He believed that the power of God would protect them. And so obviously you have to look through their lens of many being Catholic. But the response, the westernized response to coronavirus, I think it's been delayed in Nicaragua. So I think that, there's a lot of layers of the way that the threat of coronavirus, how that is perceived and how that is messaged, how that can be different country to country. Thinking about, so my, as I mentioned, well, I didn't mention, my father's from Venezuela. And although I've been brought up in Portland for most of my life, I'm really connected to my family there. And a lot of them have moved from Venezuela, but those that are there, I'm still in contact with, and I'm friends with a lot of Venezuelans here in Portland, and they obviously are in contact with their family members still there. And again, I think that they're facing just different interpretations of the virus. I know that and obviously it's similar to the US, that depending on your political ideology, you're gonna see the virus in a different way. So my friends and family members that are against the government, they're going to see it differently than those who are with the government. I think that there might be questions about official rates of the virus, and so that can affect how one perceives a threat, the threat that coronavirus brings. Also, what was just brought up, I think, is really valid. Of a lot of these people, they may in good faith want to stay home, but they can't. A lot of them live in slums or in very overcrowded areas. Unfortunately, a lot of Venezuela, a lot of Caracas has become overpopulated and affected by poverty, impoverished, and the level of living has gone down extremely. And so those who are now living in parts of Caracas that would, by US standards, be considered a slum, it's very living with many people in their home. in very close quarters, it's very impossible for them to isolate or quarantine or stay home. I feel like we have to keep in mind those, going back to Maslow's hierarchy of needs. First, it's food and shelter. And right now we know that Venezuela is going through an economic crisis. And so if they can't, their number one is to get food to their babies, to their family. Obviously, they're going to do the best they can. But I think that these are hard questions for us to answer because we don't fully understand their experience right now.
Yeah, I think that's a very valid point of view, and I really appreciate you bringing some stories from what you've heard. And I think that's really valuable. Do you feel like there is, if not a solution, do you think there's a direction? Do you think there would be some type of messaging or support, or what would it be that could help improve the response to COVID in the places that you have connections? I know it's a big question, but.
Sure. So thinking back to Nicaragua, I think knowing the Ministry of Health staff that work in the town that I worked in, I know that when there were other types of outbreaks, they would mobilize, they would organize, and then they would go out and do campaigns, going to house, and obviously they may do it differently with coronavirus, but I'm sure that knowing them and knowing at least how the strategy was then when I was there, they would do what they can. So I guess supporting that, like finding out, okay, what is a way there, how are they going to be reaching people in the town? And as a Peace Corps volunteer, we always wonder, okay, how can my projects support the Red Cross, the Ministry of Health, and nonprofits that is there. So I think just first really understanding the powers that be, what their approach is and what their process is, and see how we can support that.
Yeah, excellent. I think that is, you're right, to be pulling from those lessons learned, actually working with communities, because those are the ones that have been proven effective, slowly but surely. Does anyone else have any sort of feedback or thoughts that have come in this conversation?
I think my thought is just, what communication do we share and what are we communicating? I think there's so much still out there to be realized, and then who is the expert of information that we should be sharing, because is it coming from the country's government, or is it coming from who is it coming from, and what is that information that needs to be communicated, I think is very key, that hasn't necessarily been established yet, at least in the communities that I've seen. My husband's from England, and their communication is very different than what we're seeing in the Portland area, and how they're getting information and who's making decisions on information, on opening and phases and face mask coverings. And then in Rwanda, it's also different. And so what is that information that needs to be communicated, and how, and then how is it culturally acceptable or culturally shifted? So in homes with multiple generations living in it, how is it adaptable to them, and what does that look like? I think those kinds of questions haven't been globally established yet. I think it's still at a national level. And so it's really hard to have conversations about how to communicate when what is being communicated isn't necessarily established. It's kind of my thoughts in my head of what I struggle with.
Yeah, I think that's an excellent point. And it goes back to us not being these sort of knowledge bearers, but merely open to collecting, sharing, and passing on. What I thought of when you were speaking was, is there a way for us as professionals here working in Portland to collect stories of people around the world who are our partners, who are our allies and our coworkers, who who have had COVID or who know someone who has had COVID in their community and amplify their story. Because I agree, in ways it can be hard to figure out what the correct narrative is to share, but an individual's story, I think, is always valid and always worth being amplified, and could be more accessible to some people than sharing statistics or than sharing graphs. Yeah, just a thought. Sheila, maybe we should move to the next question.
Okay. Next question is about, actually, we've kind of touched on this, culturally responsive messaging about facts and self-help facts, which, as Sarah said, you know, there's not really a consensus on anything. So, you know, for, again, the Micronesian community, the facts that the community leaders are wanting the community to understand is that it's airborne. That's the main one, and that they you know, they have a very communal lifestyle with tiny apartments, 30 people, and they're the biggest part of the homeless population. So, you know, they can't follow what, you know, some people think are the rules to isolate. They can't. So I think your point is right. We have to figure out what are the basic facts that are indisputable, and I don't know if that even exists, and how they can prevent the spread by what they can do to keep, like, is it masks? I think there's pretty much a consensus that masks work, but then these people, where do they get masks? I mean, that question leads to many, many more. But the messaging, so the question number 2 is all about culturally responsive messaging. So you can't give the same message to a culture that's collectivist, that lives in one house for 30 people, as you might give to a person in a North European place where isolation isn't so foreign. So that was it. I don't know if we need to discuss that because we kind of brought that up, but what do you think, Jennifer?
Yeah, if that sparks anyone's interest or sparks an idea, go ahead and share. Maybe we've already touched on it enough.
I think we have, Sarah brought up some good points. So then the third one is, and third and fourth are actually tied, and it's including the voices of the communities in decisions and engaging community leaders to deliver those messages and the resources that are delivered. In other words, and I think this one of you mentioned, you know, it's not the great white savior. It's actually the people themselves who are most trusted and who will be able to reach their communities. So in order for the Micronesians to believe, because they do not trust government, they have many reasons not to trust the US government. They do not trust aid organizations or the schools, or, I mean, there's many places they don't trust because they have many reasons not to. So they're community leaders, but the community leaders going out and finding out what the needs are and doing. So the majority of the work has to be community based. And I think that's anywhere in the world. It has to come from them. It cannot be the UN agencies or the government agencies or the NGOs. They can organize. And that's my role, is I'm sitting back. My face is never seen. I'm sitting back and just helping organize. And then and do the paperwork, because if you're on the front lines, you don't have time. But so getting community leaders. So the question, I guess, is how do organizations get them, maybe relinquish authorities in a sense, to let the communities take care of themselves.
Yeah. Yeah, and we can, of course, I think all of us can see why skepticism is absolutely understandable. And the question is, how can we both support what communities decide they need for themselves, and how do we hear that? How do we, within the organizations we work for, and just as global change makers ourselves, how can we be supportive from where we sit? What is it that we can do? I wonder if at this point it might be interesting for some of us to share lessons that we've learned in other ways, maybe not COVID specifically, but just in community growth, in development, and in sort of just communicating cross-culturally. Are there some lessons out there that you've learned either professionally or personally that might be valuable to talk about in this group?
I think sometimes it's helpful to provide some sort of starting point for communities. So that way they have some sort of basis to build off of when trying to communicate what it is they need and how and what materials they need to implement that, or what training they need to implement what they need. But I think sometimes having that basis of maybe providing some guidance or some examples on what potentially they might need, and then that would help them begin to brainstorm what actually they do need. Just some quick.
Yeah, I agree, Molly. That was something that was sort of on my mind, is could this working group, or could just this group of us today sort of begin to build almost a catalog of resources that could be just given or shared as sort of a starting point, and that really communities or even individuals can look through that information and select what they feel is appropriate to share with their friends and family. Yeah, of course, again, that raises the problem of how do we vet what we are sharing? How do we vet what is correct, what is fact, and what is fact, and what is fact in America? But I think you're right that at least having those conversations about how we can empower communities to make decisions for their safety, and how we can learn from them and be empowered by them. I think it's important to start that conversation here. Who else has some lessons or feedback that they think could be valuable to this conversation?
I'll just share that I'm a language teacher, forever. I used to teach at OES. And anyway, the need for outsiders to step back and just listen is so important, and it's not natural. I mean, I think that it takes work to learn to just suppress and just listen. So we can provide examples, and I think we can work by example, but you can use that platform to be humble and to share, not as an expert or not as the rest of the world gets this, you don't, or whatever, but this is one approach, let me model it, but do you have other approaches? I just feel humility is a really big piece of empowering others to take the ropes. And I'll give an example, a WASH example in Malawi. So my project was to evaluate interventions for food security, USAID. But one intervention were boreholes and borehole maintenance, because water is life. And so I decided sustainability is really the issue. We can't do things for people if they can't be maintained, so that they can maintain and do themselves. So I did this very lengthy study of borehole maintenance, and it was very interesting. What was interesting to me is that no one of the villagers, and I was way out in the most remote villages, and the idea of sustainability, maintenance and sustainability had not really been driven home by the various implementers. It wasn't only the organization that I was evaluating, all of the different ones. They didn't think about sustainability or ongoing maintenance of this life resource. And so I had great brainstorming sessions with people to help them just think, well, what if, and do you think that if da 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 da? But the idea was very clear that these people had not actually been given the chance to take the lead and to say, huh, yeah, we can do this. And I feel that it translates to this current topic, because in the end, they themselves have to, because I don't think this is going away soon, first of all. And so if it's relevant to them, if in fact Africans aren't immune, if it's relevant, they themselves have to believe that they have the power to do something about it. Here in Hawaii, that's no different. And the communities themselves are taking the reins, because the government they don't have any US rights, and the government doesn't. The state government just ignores them. So they are taking it. But that's my story. I just think that it's empowerment through humility. Even though, yes, we may know something, we need to help them believe that they can do it. Yeah, that's it.
Can I ask a question? So in training for this job, they talked a little bit, very briefly, about the history of contact tracing, and contact tracing was used to prevent the spread of Ebola in Liberia and perhaps in other countries, in Sierra Leone or Guinea. And so I'm curious, in your experience abroad, if you've seen a version of contact tracing and what that looks like.
This is Kay. I managed an emergency cholera response project in Haiti. And while we weren't responsible, our program for contact tracing, it certainly occurred with the Ministry of Health. And in that respect, we were given information about households who actually did have incidents and cases of cholera that we would reach out to do disinfection of houses and education with respect to prevention. So, it was definitely a collaborative effort with the Ministry of Health and local NGOs. I happened to be with Mercy Corps at the time. So I think that it's definitely, it's a honed, proven practice in public health. So I think ministries of health across the globe will have a component of that. The degree of its effectiveness, and just like here in the US, right, Marielle, in terms of how much resources there are to actually do that, and the challenges with that remain. I don't know if that gets at your question, but
yeah, no, it really does. I think it makes sense. It's been a universal practice, and it's been used in many outbreaks. But I'm just curious what your experience is witnessing it or being part of it abroad.
Yeah, I think the thing that is different a little bit from at least my knowledge of what I see here in the US is that it was much more tied to not just like identifying cases, but transferring information and giving resources and maybe even interventions more so than here. And because I'm not really involved in that in the US, but I've looked at a couple, of the positions and whatnot, that more of it's, I mean, it's very, it's all done pretty much over the phone, of course, because of COVID and whatnot, but it's more, I don't want to use the word sterile, compared to community outreach in more rural communities in developing countries, where people don't necessarily, I mean, more so now than in the past, have access to phones and all of that. But I think that's one of the main differences in my experience. I think that's changing though.
Definitely, and I think that, I don't know, in my experience, just thinking on my experience as a Peace Corps volunteer, I think that it's, in order to show that you were caring for the person or the patient, I think that it came across as much more meaningful to them if you did that in-person work. And of course, here in the US, there's a lot of different factors and constraints, but yeah, no, what you're saying makes sense.
The one thing that I'll add to in terms of the lessons learned, and in particular, and I think this relates to WASH, but just in terms of disease intervention control measures as well, is that oftentimes we look at the threat of dying or being sick as the motivator for changing behavior. And to prevent COVID is all about behavior change. So you have to wash your hands, you have to cover your mouth, all of those things at important times. And too often, I think what I've seen in WASH programming in particular, but it relates to this obviously, is that people will use off-the-shelf communication tools. The big one is the 5 F's, which you've probably you've seen if you've done any WASH work: fingers, food, flies, those are the ways to motivate people to hand wash. And I think that one of the risks with COVID as well is that we're using the risk of illness or disease to change behavior, which may not be the motivating thing to get people to change their behavior. And how to find out what motivates people's behavior change involves what Sheila's been talking about, really talking to communities as to what gets them to wash their hands or to wear a mask in a house with 30 people, those kinds of things, and to dive into that more exploratory work. And that can take time, but it can result in better outcomes in the end, as opposed to just telling people, the classic, don't smoke, you'll get cancer, or brush your teeth, so your teeth don't fall out. Well, we're not very good at doing those things. So I think doing good CAP studies and good key informant interviews and focus groups with groups to really get at what will motivate them to do those practices that we know will prevent COVID, because we know what will to many degrees right now. But how do we get people to change their behavior to prevent that is the challenge. That's just my lessons learned from this work.
Yeah, I think that's spot on. I think starting with the outcome we want and then making assumptions about how to get there isn't nearly as effective as starting with what really is the motivation out there. Are people afraid? Are people apathetic? What truly is happening? And then to say, okay, this is the sense, this is the feeling. Let's talk more about motivation. Let's talk more about how all of these things are linked. I think that's vital, and I have to tip my hat to Sheila, who's done a lot of this work in preparation for this call, really being in touch with people and trying to start the conversation about how we can be supportive and how we can be resources to others. So I really appreciate that, Sheila. Everyone, we did schedule this meeting for an hour and a half, but I want to be cognizant that some of you might have only an hour on your lunch break, you might have other things going on. So just so you know, our second half, the coming half hour of this call is intended to be focused on if you would like to be a part of the working group that we would like to build. What would that look like? How much would you like to participate? And how can we get started? So we can definitely wrap up here for some of you if you'd like, just show an indication of how many of you have to hop off. How are we feeling?
I have to jump off too, but it was great to meet everyone and listen to what everyone has
Really
to say.
good to meet you too, Molly.
Thank you.
Welcome to Portland.
Yeah.
I have to hop off too, but thank you again, Sheila. Thank you for all the work you've been doing. This has been awesome conversation.
Yeah, I need to go as well. Thank you. Nice to meet you all, and good luck with this effort. I was just thinking one of the things that motivated people to change their behavior in the US with respect to mask wearing was not so much the mandate, but that the idea that they would be put on lockdown again and not be able to go to work and stuff. It wasn't like to prevent disease from, it was really interesting. I was talking to the cashier at Fred Meyer's and she's like, oh, we're afraid that, we won't be able to do what. So, it's not always what we think it's going to be.
Yeah, so true. Well, since it sounds like a lot of us have had to go already, I'd just say that Sheila will reach out afterwards with sort of a post-call roundup and invite people to be a part of the working group and to email me a ton of resources. And we can start building sort of just a collection of those resources and things that we can share.
Great. Thank you. Thank you.
Thank you so much. Have a good one.
Okay. So yeah, that was interesting. I don't know if we inspired